Hello there. Welcome, everyone. This is Play It Forward Show with Allison, vanCott, McEntee. You are listening to WUSB 90.1 FM and 107.3 FM. And, of course, I'm here with my wonderful co-host, Kate Valerio.
Hello, everyone. Pleasure to be here, Allison.
Thank you, Kate. And we have a wonderful guest joining us today, Elizabeth Schwartz. She's a board-certified music therapist. It is an incredible honor. Elizabeth, welcome to the show.
Thank you so much for having me. So glad to be here.
Great. It is our organization, for those in the listening audience, advocates the professional field of music therapy here at the university. And Elizabeth and I were just literally talking a few minutes ago how it's so amazing, and we have this great university, a hospital right across the street, and so little people know about this field. Tell us more about exactly what is the professional field of music therapy.
Great. I'm so happy to have the opportunity to talk about it. Music therapy has actually been a profession for over 70 years.
Wow.
And it's much more active here on Long Island, and particularly in this area in Suffolk County, than many people realize. It offers a wonderful opportunity for people to really connect through music, but also to find healing and health and harmony within their community. So the question first is, what is it? And I think this
Yes.
is confusing for people. We are different than learning to play music. We are different than going to a concert. What we do as music therapists is understand how music is processed in our brains and music is processed in our personhood. And we use what we know about music in order to help people find the opportunity for greater health, for greater happiness, for greater connections within their world. And we specifically focus on people who have needs, whether it's health needs, whether it's needs, social needs, communication needs, social needs. We are there to work. Music therapists work, we say the term cradle to grave, although that's very difficult to say. But we have over 10,000 board-certified music therapists in the United States.
Wow, and it's growing.
And it's growing very quickly.
That's a very good thing, and that's one of the things that our organization aims to do is create more awareness and the education of it. Maybe perhaps you would like to go a little bit into that, because we had the wonderful pleasure, one of your proteges, if you will, Allie B. A shout out to Alexandra B., amazing music therapist. She was a guest speaker at one of our club meetings. And why don't you tell us a little bit about the music therapists that are here at Stony Brook University and the hospital?
I'd love to. I really would like to highlight their work. Stony Brook, and particularly Stony Brook Hospital, is such a huge facility that it's hard to really understand everything that's going on. So I'd like to just represent what's going on within Stony Brook, and starting with Allie B. Allie really provides services on the medical side of the hospital. So Allie is there full-time, and she is working on a number of different units, including your children's hospital, and provides services for children and adults and families who need them throughout the hospital. Allie is very willing to be connected with any of you who would like to find her, and if you just go Allie, ALI.BBIE at Stony Brook, her Stony Brook address, you can find her, and she'd really be happy to connect with any of you to find that. We also have a music therapist, John Reichert, who was a student of mine at Malloy College, and John works with people in the mental health and psychiatry units. And John is an absolutely amazing music therapist who has an amazing life experience that he brought to the field of music therapy later in life. And so you are so fortunate to have John. And he is here over in the hospital here on the main campus. I'm going to tell you about one other initiative that a lot of people don't know about. Another colleague of mine, Lee Morris. Lee is the main music therapist right now at St. Charles Hospital over in Port Jefferson, but Lee has been working along with Stony Brook Southampton staff and a number of your researchers here at Stony Brook University studying the effects of music therapy for people with Parkinson's. And she would be another absolutely wonderful guest. Some of the research has already been published, and they are right now in a very large study.
Wow, that's amazing. And that with Parkinson's in regards to music therapy, I did read a little bit about the research that was going on in relation to that. And I think a lot of it has to do with their gait, right? And the rhythm and more tempos and rhythm, right? Do I have that right?
So let me just talk a little bit about that, because I think it's important to connect it to people's own lives. So for those of you listening, you go to the gym in the morning, or you're out for a walk in the morning, and the first thing you do is to turn on your Spotify list or your Apple playlist, and you're going to find a piece of music that is within the tempo that you want to be running or walking or exercising in. And we know from our research studies that the human brain and human physiology naturally falls into the rhythm and tempo of music.
Yes.
We use a term called entrainment for that.
Yeah.
And we all use entrainment in everyday life to entrain ourselves to move faster, to move slower, to slow down, to speed up. And so we use this, I call it the magic of entrainment, musical entrainment, to help, we're going to talk specifically about Parkinson's and some of those other disorders right now of movement and gait, that we are able to use the way the brain processes the rhythm and the tempo within music. And we know that even beyond the challenges to processing movement, the rhythm of the music can allow for the brain to reset.
It's a physiological reaction, right? With new neural pathways being
physiological and neurological.
Yes.
But we can't ignore the social nature of it and the emotional nature of it. So I'm just going to mention that all three music therapists that you have working at Stony Brook also understand that you can't have health if you don't have emotional and social health.
I can't agree with you more.
Yeah, so we really do focus in on allowing the opportunity for patients in the hospital to really examine themselves and their identities as it changes and morphs with their disease and their disease progression. So whether it's Parkinson's or Alzheimer's or autism or any other kind of physical disorder, there is always an emotional and social component. And so we work with that. And I'd be happy to talk a little bit more about that.
Please do. I mean, it's a spectrum, right?
So,
huge.
As I said, music therapists work from cradle to grave, and we do work with every kind of person. So we really like to think that our services are individualized. So there is not one size fits all of music therapy. It has to be tailored to each individual, and this is why education is so important. So I'm going to divert for a minute, if you don't mind, to talk a little bit about the education that is required for music therapists.
Please do.
So we train in music therapy in this country on the bachelor's, master's, and doctoral level. In the state of New York right now, we have 5 music therapy programs. One here on Long Island, Molloy College. I'm a faculty member. New York University in downtown Manhattan. 2 state universities. And I'll talk about that in just a minute. We have SUNY Newport and SUNY Fredonia. Yes. And then, I'm sorry, I misspoke. We have a brand new, there are 6 programs in the state of New York now. Up in the Rochester area, Nazareth College, which is a long-standing music therapy program, and a brand new program at Roberts Wesleyan, which is a small liberal arts college in Rochester. Wow. That's a brand new program. Congratulations. Yeah, and I think one of the things that Stony Brook listeners should understand is that we already have 2 very vibrant and long-standing programs in music therapy in the State University of New York system. Would it be wonderful to have another one at Stony Brook?
Yes.
Well, I was born and raised here in Long Island. I live here. I've worked most of my life here, and it would be amazing, mainly because to me, Stony Brook is the perfect melding between art and science.
Yes.
And when I think about what Stony Brook University offers to the community, you offer such a vibrant arts education and such a vibrant arts outreach to the community. Yes. And yet you've got probably one of the strongest healthcare education in the state university system. And so it just
and the country.
and the country, and it does seem logical to me that this would be a good place. Nevertheless, we would hope that students who are doing their undergraduate degree in either healthcare or art would consider going on and doing a master's in music therapy. And we've had a number of students who have done their degrees in something other than music therapy who come and do their master's in music therapy. And you can become both a board certified music therapist as well as a licensed creative arts therapist doing that path.
Well, that brings me to my next question about licensing, and we were just discussing before we came on the air. Why don't you tell us a little bit more about how it works in the state of New York?
Sure. So, as you know, again, being here at Stony Brook, that you need to have two things. You need to have recognition of a service, and you need to have funding of a service. And so it's really, really important to make sure that the services that are provided are recognized as a profession within the state which you work, but also that people will pay you for it.
Yes.
So music therapists, most people don't know, are eligible to practice as a licensed creative arts therapist in the state of New York. We are one of the 50-plus professions recognized by the New York State Education Department, and we are in the same category as mental health counselors and psychoanalysts.
Wow.
Yeah. And marriage and family therapists.
It is such an incredibly important field, and I'm glad that you brought up how Stony Brook is such a great combination of the arts and the sciences. Our slogan for the Play It Forward Project Club is we would like to see Stony Brook go from STEM to STEAM. And, of course, the A being for the arts. I think a lot of people don't realize the incredible music program that's here. And not to mention, like you said, with the research and the healthcare professionals, the budding doctors and nurses, that combination really needs to happen. Yeah. It really does. And it's time.
Yeah. And it is happening around the country. So I would like to just talk a little bit about the research initiatives that are going on around the country. But before I do that, if I could, I want to backtrack a little bit to talk about the requirements for music therapy. And they're significant. I think many students who come in after having other degrees are surprised at how rigorous our training is. And so as a music therapist, we are required on the arts side to have competency in playing guitar, piano, percussion, as well as voice. We also need to have a firm foundation in psychological studies as well as developmental studies. We also need to understand group dynamics and the way to work within groups of people. And our job is to meld all of that together in music therapy techniques and interventions, all under a theoretical framework. So it's intense. Music therapists are required to do 1,200 hours of service, on-site service in training, in clinical placements. And it's a lot. I believe in the state of New York, only social workers have more clinical placement hours in terms of the types of services we're talking about. So it is intense training. And we really value students who come in with strong musical backgrounds, but not necessarily classical musical backgrounds. So we are actively seeking out people who have core musicality. And I always look for that player in the subway who just rocks all those people. Those are the kind of people we want because they have that core musicality. We can teach them everything else.
It's about connecting.
We're looking. It's about connecting.
Yes, I completely agree with you. And in our club, one of the things we emphasize is, we exhibit our advocacy by performing. We do hospital lobby performances. We even do bedside performances. But one thing we do is we emphasize and we make it a known fact when we walk into any patient's room or in the hospital. We are indeed an advocacy club. we are trying to bring more awareness, and I can't think of a better way to bring more awareness by playing music. However, it's not the same thing. And so we distribute fact sheets that are from the American Music Therapy Association. I'm actually a member of the association. I get a lot of information from there and pass it on to our members, and then, of course, advocating and educating the university. And it is amazing to me how little our members and even the faculty and staff and the medical professionals are not aware of the details of this field.
Yeah, absolutely. And I think it's important to understand that music therapists don't own music. We are not trying to stop people from making music in healthcare settings or in educational settings. We actually encourage that, although we ask that it's under the guidance of a music therapist. Yeah. And so there's a story that I often tell that might help understand the difference. That if you have a patient who's come in and they have a complex orthopedic surgery, and so they really need some kind of rehab, and the hospital happens to have an alumni who was an NFL quarterback, and they invite that NFL quarterback to come in because it would be motivating for this patient. But what the NFL quarterback understands about the body is what he understands about his body and his ability to move. So if you have this person just coming in and saying to the patient, try this, try that, it could actually cause harm. Right. So who you need is a physical therapist.
Right.
So you need somebody with expertise in how human bodies are created and work and really understand the details of it. Right. It's not that you don't want that linebacker there, but you want that linebacker to provide the motivation under the guidance of a physical therapist. It's the same with music therapy. Most hospitals, programs across the country are welcoming of entertainers and people coming in to play music. However, music can cause harm. And I'll give you a very quick example because I think it's important to understand. So, and I have seen this happen with my own eyes, is that very well-meaning people come in and they want to play music for a patient. And I'm thinking of a patient with dementia. And so they're going to come in and they know a certain repertoire. Mm-hmm. And so they will play the songs they know that they think maybe that person might like. Okay. And I have seen it happen where a very well-meaning person will play a song and the patient with dementia will suddenly become very agitated and really have a hard time, and so much so that the nursing staff will have to come and remove them, and everybody gets really upset, and it really it is negative for that patient. And what the entertainer or the musician doesn't understand is that there's a personal connection. Yeah. Maybe that was that patient's wedding song.
I was just thinking along those lines, or maybe it was a time of war, and it was, for many folks at this age, those are the memories of their youth, and I agree with you on that completely, and that is important to note.
It's important to know, and the solution to that is to consult with a music therapist first. And we have colleagues in Europe and the United Kingdom. There is a much broader understanding of music therapy, and the saying is that anywhere that there is an intersection between human beings, music, and health, there should be a music therapist at the apex, because we are the only ones who understand that intersection point.
Yes.
But from then on in, we can guide other people to provide appropriate music services for our patients, our clients, and the people that we're working with.
That was so well said, because I struggle at times trying to explain. I'm not a music therapist, but reading so much about it and trying to advocate for it, it is a difficult job to explain to the layman person, and so. Why don't you, actually, I'd like to, what inspired you to become a music therapist?
Well, thank you for asking that. I actually was born and raised right here in the area near Stony Brook in Mount Sinai to a very, very musical family. So one side of my family was very musical, but we also had a strong emphasis on service. And so we spent a lot of time providing services in the community with my parents. And because music was such a big part of my life, it was always within music that I would go into the community. So it just interested me to do that. And I was fortunate to be able to do first an undergraduate degree at Crane School of Music in Potsdam in special education music. And then through that, work with one of the recognized pioneers of music therapy, Dr. Clive Robbins. And he was my mentor, friend, and colleague for his entire life. And just have been able to enjoy the fruits of my understanding of music from my family, but also my training. I did my master's level at New York University, and now I'm fortunate to be able to write. I've written 5 books and book chapters and present all over the world, and it's exciting because we are growing. So I know that we're a little short on time, and if it's okay with you, there's 2 things I'd like to first talk about. So what do we do? What do we do in music therapy?
We'll take it away.
Yeah. So there are many ways that people experience music, and one is singing songs that are already created, and we do that a lot. We call that recreative music, and a lot of people feel that within the safety of a familiar song, they can feel comfortable in themselves. They can begin to connect again to their identity, and we know that sickness and disease destroys identity, and so we can bring that back. We also use a lot of improvisational music therapy, where the therapist and the client are creating music in the moment that is meaningful to the client and the patient, but also can guide them into maybe changing mood states, changing physical states. So we can begin perhaps in a slower, softer, more thoughtful kind of music, and then improvise the music to have it become more engaged, more uplifting, so that we can provide that mood state swing. We also do quite a bit of listening, and we call that receptive music. And for many of the patients in the hospital, carefully selected listening is really important. And I have to use the term carefully selected because there are programs out there that people feel they can just use a standard formula, and that frankly can cause harm. So we have to be really careful. We can't just give every piece of music that we like in a playlist to a patient and expect that to
and
work.
assume that they are going to like it as well.
Right. And that is our job as music therapists.
You have to be very intuitive.
You have to be intuitive, but intuition, and I say this all the time to my students, intuition is based on a huge and broad depth of knowledge. So you only can really have intuition if you have that depth of knowledge and open yourself up to truly be able to listen to your clients and to your patients, and to be present for them, and to be able to create the music not that you want or you know or you've practiced, but the music that that patient needs in the moment. And that's what we do.
And meaningful to them, and for to heal.
Yeah.
So
as we finish up, the time goes very quickly. I just want to mention how exciting the field of music therapy is right now. And we have a number of research initiatives going on around the world that people should really know about. So one is the Sound Health Initiative that was begun as a partnership between NIH, the National Institute of Health, and the Kennedy Center. And they combined together with really 2 people, Dr. Francis Collins and Renee Fleming. Actually, Renee was here and did your gala concert a couple years ago. And so I was able to talk and meet with her. But through that initiative, they were able to provide 2 really invigorating research conferences down at the Kennedy Center with music therapists, music cognition researchers, music sociologists, all kinds of people involved in music to combine that. And out of that came this project called the Sound Health Network. Wow. So the Sound Health Network is now based through the University of California, San Francisco, through UCSF. And if you just go to Sound Health Network and Google it, all of the past presentations from the Kennedy Center at NIH are housed to the Sound Health Network. And so you can listen to all kinds of people talk about the value of music. And again, through that initiative in September of 2019, the NIH and the National Endowment for the Arts released $20 million to be spent over 5 years to research the importance of music in health. And I'm proud to say that some of that money went to my college, or one of my colleges, Malloy College, that we are now doing mental health outreach, and music therapists and some of our music therapy students are part of that, where we're taking a van out into low resource communities and providing mental health services. And I'm proud to say that some of the Malloy staff and a number of our students will be part of that initiative. Yeah, so
yes,
there's
congratulations. That is wonderful work.
That's my colleagues at Malloy who really wrote that grant. Another big exciting initiative that I'm going to talk about is through the University of Melbourne. They do really cutting-edge research, and they have just started a multi-year, multi-site project on studying music in dementia care and caregivers. And that is through my colleagues at the University of Melbourne in Australia. So I'm really excited to see how that comes out.
This is such a thrill to have you. I mean, we definitely want to have you back because there's so much more to talk about.
Well, I'm always happy to talk about music therapy, as you can see.
Yes, and me as well, and I've so much to learn. I mean, just in this less than a half an hour, I just learned so much that I can now pass on to my members, and we hope that you would join us in one of our meetings, so we can, really. I hope everyone here at Stony Brook and on campus is tuning in to this special guest today. But yeah, we really would like to bring more awareness to this amazing field.
Yeah, that would be terrific. And just for your listeners out there, to access music therapists, if you go to musictherapy.org, there is a link to find a therapist, and you can find a therapist in your area who can provide services. For those of you at Stony Brook, find Allie, ALI.BIE at her Stony Brook hospital, Allie B at her Stony Brook hospital address, and she'd be happy to connect with you. I also want to say that here on Long Island in Suffolk County, we work in a number of schools, and so we are providing approved related services on children's individualized education plans in many of the school districts here on Long Island. And so please feel free to reach out to me, and I can connect you with somebody. You can get me at my Malloy address. It's eschwartz, SCHWARTZ, at malloy.edu.
Thank you very much. And Allison, prior to the beginning of the show,
Yes.
we talked about tuned in former students of ours.
Yes.
And I know you wanted to give a special shout out to those 2020 graduates.
Yes, congratulations to the class of 2020 who had finally had their in-person commencement ceremony last Friday. It was a gorgeous day. I'm so happy for them. Big shout out to Rahul Kulkarni and China Rios, former board members of the Play It Forward project when we first incepted our program here. And Rahul is still actively working with our organization, although he's on probably driving an ambulance right now as we speak. Yeah, great group of kids that I work with, and I do hope that you get to meet them, Elizabeth, because
I would love to meet them.
It's a great group of pre-med students that love music, and that's really what we're honing in on, because that's what it's really all about.
Yeah,
right?
absolutely. And I love to talk to medical students. I happen to have a daughter and a son-in-law who are physicians, and they, at every hospital they've worked in, they have worked closely with the music therapist.
Awesome, and I'm sure you made sure of that, right?
Oh, yes.
Well, it has been such a pleasure to have you with us today, Elizabeth. I want to thank you tremendously, to you and all the other music therapists out there that are doing amazing work. We really hope we can say the same thing as that newer program that was just. I hope we get that here at Stony Brook one day. I really do, and you'll cut the ribbon with me, right?
I absolutely will come and support you.
And
So
you best invite me.
okay.
But we do hope you come back again, Elizabeth. And for those of you that have any more questions for Elizabeth, again, feel free to reach out to her. She also has a website, a center, music therapy center called Raising Harmony. And it's at www.raisingharmony.com. So go check her organization out. And I just want to thank you, Kate, for being my co-host again. And for everyone that's listening, we will you'll hear back from us in 2 weeks. You are listening to WUSB Play It Forward.